Okay, it's 7:30, so we're going to go ahead and get started. Welcome, everyone. Welcome to the first of our monthly Global Network webinar series. This is Nancy Hazelton, SIBF Executive Director. And thank you all for joining us at this early hour. But as we know, this is an important topic. And before we get started, I would like everyone to know that if you have a question for our speaker, please use the Q&A button at the bottom of the screen, not the chat button. If you ask questions through the chat, they won't be submitted. You can talk to each other through the chat. We will take as many questions as we possibly can during the time we have. And we're going to let our speaker, Marybeth, go ahead and do her presentation before we start asking questions. So I'm going to turn it over to Heather Dexter to introduce our speaker. Heather is CEO of Emory St. Joseph's Hospital based in Atlanta, Georgia in the United States. Heather, I'll let you take it from here.
Great, thank you, Nancy. Good morning, everyone. As Nancy mentioned, I'm the CEO of Emory St. Joseph's Hospital here in Atlanta. My husband, Blake Dexter, and I have been part of the SIBF network since 2015. And I'm pleased to be part of this first Global Network webinar series. My role here today is really just to introduce you to one of my incredibly talented colleagues, Dr. Marybeth Sexton. Dr. Sexton is an infectious disease specialist and a professor at Emory University. She did her medical training at Emory and then completed a residency in internal medicine at New York Presbyterian, and then a fellowship in infectious disease back at Emory. Dr. Sexton is double boarded in internal medicine and infectious disease, and is a critical team member of the Emory University Serious Communicable Disease Program. This program is inclusive of a dedicated unit within Emory University Hospital, which is capable of handling biosafety level 4 pathogens. The unit was originally built under contract with the CDC to provide care in the event that a CDC employee was exposed to a serious contagious disease in the line of duty. In 2014, it was the highly trained team from this program and the dedicated unit that allowed us to successfully care for 4 Ebola patients. Let me be very clear here. COVID-19, the novel coronavirus, is not one of those serious pathogens that requires care in a facility of this type. However, the Serious Communicable Disease Program at Emory has become regional, national, and international resource on the strict protocols that are needed to safely care for any contagious disease. Today's speaker, Dr. Marybeth Sexton, is not only a member of this team, but is also providing leadership in Emory Healthcare's efforts for preparedness and response to COVID-19. With that, I'd like to welcome Dr. Sexton to SIBF's first Global Network webinar series.
Thank you, Heather. I hope everybody can hear me. I'm going to just adjust this here. So I know that coronavirus has been a very hot topic in the media over the last couple of weeks, and there's a lot of new and changing information out there almost daily. So I'll just talk really briefly about what we do and don't know about coronavirus to this point and what you can all do to protect yourselves and your families, and then I'll be happy to take some questions. Here we go. Good. Okay. So this novel coronavirus was first identified in China in December of 2019, just heading into 2020. I think what everybody now knows is this had likely been circulating for weeks to months before it was identified. And what was challenging is the symptoms that this causes can look very much like the common cold or the flu. And so I think it took a while to realize that they really had something new. What happened ultimately was that there was a cluster of hospitalized patients with what looked like viral pneumonias, and all testing for all known viruses was negative. And so when they went looking, they identified this novel coronavirus that we're now calling COVID-19. And the coronavirus family is a big group of viruses. They do include a bunch of seasonal viruses that really do cause the common cold. And then they include things like SARS and MERS that have become more well-known for being more deadly. This COVID-19 is sort of in the middle of those two things. It's more serious than the common cold, but its mortality doesn't approach that which was reported with SARS and with MERS. The mortality rate of this looks like it's somewhere between 0.5 and 4%, whereas SARS was more in the 9 to 10% range and MERS is in the 25 to 33% range. So this, thankfully, is less deadly than those. It has since that time spread significantly to the point that the WHO has now called this a pandemic. There are cases reported in mainland China where this started, still is the predominant, but we've got at this point more than 1,000 cases in the United States and cases in almost all countries worldwide. So this does have a wide range of symptoms. And what is both good about this and also has created some trouble in containing it is that more than 80% of people who get this have a very mild illness of the kind where they likely don't need to seek medical care and they certainly don't need to be hospitalized. That's good news for most people who have this. They're pretty mildly ill. The problem is it makes this very hard to tell it apart from things like colds and seasonal respiratory viruses and the flu. And so it's harder to stop it because a lot of people don't realize what they have. And so that's why I think we've seen this degree of spread this quickly. So most people who have this have a fever and or a cough, sometimes some nasal congestion and sore throat. More serious cases have some shortness of breath, and we do see people who have pneumonia as part of this. And then a very small fraction of people, about 5% of people who get this, are sick enough to need to be in a higher level hospital setting and potentially an intensive care unit of the people who get hospitalized. So, for every 10 people who have this, 0 to 1 of them is seriously ill, 1 of them needs to be in the hospital, and 8 of them are just fine on their couch with some tea and some television. And what we are learning in terms of how this is spread is that, like most of the coronaviruses and most of our seasonal respiratory viruses, this is spread through respiratory droplets. So this is things that people cough or sneeze out into the air right in front of them and somebody else breathes it in. So you need pretty close contact with somebody for a relatively long period of time to get this. There's some thought that there may be some contact kind of transmission. So if you cough or sneeze on a doorknob and somebody else opens the door and then puts their hand in their mouth or on their nose or their eyes, that you might be able to spread it that way. It does not look like, outside of hospital settings, that this is probably particularly airborne. In the hospital, we do things like put in breathing tubes and suction people and make them cough samples up for testing. Those things may put the virus into the air in that way, but probably not out in the community, which is also good news. So in terms of how to protect yourself from this, the best things to do are the same common sense things you should do every year during cold and flu season. One of them is to have gotten a flu shot. And that's because if you get the flu right now, it's very hard to tell whether you have the flu or you have this, and you're going to scare everyone around you and yourself. It's also just helpful if you've got that protection against the flu so you don't get more than one thing at the same time. The other things are very common sense as well, and they are washing your hands a lot, because we do think it's possible that you could pick this up on surfaces and then touch your face. And along those lines, avoiding touching your face, not putting your hands in your mouth or your nose or your eyes. And every time one of these things happen, that's when I realize how often I do that with my hands, how much I have them up to my face, but really trying to avoid that. And then the final thing is that the best thing people can do is to not expose other people if you are sick. So if you're sick, this is a great excuse to not go to work and take a day off. I know in medical training, for example, we're all taught that we should continue to work and we really need to be there and it's important, but it's really important that we don't endanger our patients. And it's also important that you don't endanger your family, friends, people in the community, people in your office. And so if you have symptoms, you should stay home and you should try to separate yourself from other people in the house as much as possible. The Centers for Disease Control and the World Health Organization call that social distancing. That's what they mean. They mean not going to the grocery store, the movie theater, a meeting when you're sick, and they mean trying to stay in another room and not be right on top of the people you live with if they're not sick. So those are the absolute most important things you can do. There's been a lot of questions around testing for this worldwide. And in some ways, this is a great success story between when we identified this virus and when there was a test for it. But there have been a lot of concerns about availability of the test. And those continue to be the case just because you need to have a lab who can run the test, who's validated it, who has the equipment, and it takes a couple hours to do. It's just right now, it's not a rapid test in most places. So we're not testing everybody, but that's why those other control measures are so important. Because if we can't test everybody, but everybody who doesn't feel well stays home, we will stop the spread of this. And so that's where we are at. There have also been questions that I've gotten around the hospital about, is there treatment for this? Is there a vaccine for this? So there's no approved treatment for this type of virus, but there are a couple of drugs that are in studies that look like they may be effective. And so for people who are sick enough to be in the hospital, and particularly for people who are critically ill, we are across the United States and across other countries enrolling them in clinical trials of some of those medicines. So it's very possible there are things out there that are going to be proven during this outbreak to help. And the same thing is true with the vaccine. There is not one right now. There are people working around the clock. Based on how often it usually takes to bring up a vaccine like this and to test it and to know that it works, I would guess we're still probably a year away from that, but people are trying to push the envelope on how quickly something like that is available. So I think that this, again, is something that is new. And so that's one of the reasons that I think people do find it a little scary, but it is something that for most people causes very mild illness. And it's something that we can get control of with some very common sense measures, like not going out while ill, washing our hands, and not touching our face. The other question that has come out a lot is, how serious is this really if I get it? And a lot of these questions around some of the data out there about risks for severe infection, including age. So in terms of how serious this is, I think the mortality rate in the media looks higher than it actually is for real. And the reason for that is that I think the denominator is wrong. So our overall case count, when we're looking at deaths over that overall case count, is probably double what we know, because so many people are mildly ill and will have not known they had this and not known to get tested. The best example for that is South Korea, where they've been incredibly aggressive about testing anyone with any kind of symptoms. And so their mortality rate is between 0.6 and 0.7%, which is dramatically lower than the 3 to 4% that's being reported internationally and out of mainland China. And that's all about testing numbers and denominator. So I think that is very good news. In terms of people who are at risk for severe disease, this is very similar to other respiratory diseases and the flu. So it's people who have underlying medical problems, things like heart and lung disease, where it can be harder to battle something like this, particularly if you get pneumonia. And the age that they're putting on this, when they talk about people over 60 or people over 65, a lot of that is just because the older you get, the more likely you are to have one of those medical conditions that puts you at risk for complications. There may also be something to changes to the immune system with aging that make it a little harder to fight something like this off. But even in that older age group, it's still a small percentage of people who get severe illness. Most people across the board are having a fairly mild illness with this, and that's all good news, but it does make this harder to control when people don't know what they have. So that's where, again, those control measures really matter. And so at that point, I'm happy to look at questions and take any questions that anybody has.
Okay, Marybeth, I've got some great questions here. One is, what is the error rate on the test, and what is the protocol accordingly?
So I don't think we know, and there's a couple reasons for that. One is that there are a couple different tests. There are hospitals that have brought up their own test. State health departments have brought up the CDC's test in the United States. The World Health Organization has its own test. And it also matters what kind of sample you put on the test. So we know, for example, that a swab of your nose is decent, but that if somebody can cough up a sample, that's better in terms of the sensitivity and specificity of the test. So the test you're using matters, how well you collected the sample matters, and where you collected the sample from matters. So I think there's still a lot that we're going to learn about that. In terms of what we do if we think that there might be false negatives, is in the hospital, we're not taking people off isolation precautions until we have an alternative diagnosis. So if we have somebody who looks like they have a viral illness and all their testing's negative and their COVID testing is negative, we're still leaving them on isolation because they have something viral and no one wants whatever it is. Out in the community, we're saying that people who feel sick should stay home for at least 7 days from when their symptoms started. or 72 hours after they started to feel better, whichever one of those is longer. And that will really help us even if we are having false negatives on the test.
Okay, thank you. The next question. Recently, I had an employee return from international travel to Spain. At present, we have asked them to work remote for at least their first few days. How long should we ask them to work remotely? And what policies or guidelines would you recommend for employees that are traveling both domestic and internationally?
So I think that this is a challenging question because I think that the question of travel is about to be a moot point. I think that for the most part, this is everywhere and this is spreading in the community. And so you may be at no more or less risk with travel than you are going to your local grocery store. I think the exception to that is there are some clear hotspots, but most of those have been locked down. I mean, Northern Italy clearly has significant spread of this at the moment. Mainland China's numbers are dropping, but still higher. So there are places that you would definitely want to avoid based on that. But I think that most countries at this point are reporting cases and are probably starting to have spread in the community. So I don't know that for very much longer it's going to make sense to isolate people based on their travel history when they're just as likely to have encountered it in the community. What I also think along those lines, though, is that there is not great data that people who don't have symptoms can spread this. There are probably people who have asymptomatic infections where if you swabbed their nose, you might pick it up, but it's very unclear that those people spread it to other people. And when you do contact tracing of these big outbreak areas, almost everybody has a clear tie to somebody who had symptoms. So what I would say is for the most part, people who are not symptomatic can come to work as normal. But if they develop symptoms, and keeping in mind that those symptoms can be fairly mild, they should immediately go home and should not come back for 7 days or 72 hours after they start feeling better, whichever one of those two things is longer. And that's based on some work that the University of Washington has done around the outbreak in Seattle. I think there are a handful of exceptions to that because there are places where governments have actually instituted their own travel restrictions that are going to supersede anything that your business might do. So in the United States, for example, people have said that if you've been to Italy, Iran, South Korea, or China, please stay home for 14 days after you come back. And so that is something that you may have to follow regardless of what your policy is. For other types of travel, I would say if they become symptomatic, they should immediately go home. And otherwise, there may not be any more risk associated with that than with anything else.
Next question. Some of the travel warnings have been directed at older adults, even if they don't have an underlying condition. What do they define? How do they define older adults?
Most of the studies where they've done an age cutoff for this have looked at 65 and older.
Okay. How many coronavirus types are there?
So that we know of, there are 4 main strains of the seasonal coronavirus, and then there are SARS and MERS, and then this current COVID. In terms of the ones that infect humans, there are many, many more than that out there. And coronaviruses are zoonotic, meaning that they can transmit from certain types of animals to people. So this will probably not be the last new one we see.
Okay. I keep hearing that there is a possibility 2/3 of Americans will contract this virus. How realistic is that? If that is the case, how long will it take to contain this?
So I think that right now, no one really knows. Is that possible? Sure it is. And it depends right now on sort of the success of these measures that we can get into place for control. With any infection like this, how fast you control it really depends on how fast you develop a pool of people who are immune. So people who've already had it or people who've been vaccinated. And in this case, because we can't vaccinate yet, that option doesn't exist. And it depends on how effective these other types of infection control measures that are simpler, like staying home when you're ill, how effective those are and how well people adhere to them. And I think that's going to determine how many people get infected and how fast it spreads, as well as how fast we can contain it.
Marybeth, Does the environmental temperature make a difference?
So the discussion about whether the changing of the seasons was going to help us comes based on what we know about respiratory viruses in general. So there's a reason that cold and flu season is usually in the winter. And it's because it's cold outside, everybody spends time inside. So everybody is in much closer quarters with each other. And so more likely to spread something if they're sick, because everybody's kind of on top of each other in the same room instead of spending a lot of time outside. We don't know enough yet to know if that's going to help us here. It may help us a little as we get into a warmer part of the year in a lot of the world, but given how quickly this is spreading, that's probably not going to be sufficient to stop it. And then in terms of whether heat really kills the virus, so things like a surgical instrument going through an autoclave where you're trying to sterilize it, that absolutely kills this. This is not particularly hard to kill on surfaces. All of your household cleaning wipes will take care of it. Soap and water or hand sanitizer on your hands will take care of it. But the outdoor temperature and how much that's going to help us remains to be seen. It'll probably help a little.
Okay. Now we see that Emory University, Harvard have told everyone to stay off campus. Why would they and other universities do this?
So what they're thinking is that with any kind of respiratory virus, the easiest way for it to spread is a lot of people in close quarters. And so living in a dorm is what they're thinking about. This is the same reason that we have starting to see outbreaks in nursing homes. It's when you get a lot of people in the same space. So what I think they're hoping to do is that if they send students back to stay with their parents, you've got a small number of people in a living area that they don't share with a lot of other people. And so you're just less likely to have rapid spread. That's what they're hoping.
Okay. Where or how can non-hospital community physicians get access to the COVID-19 testing for their patients?
So right now, both Quest and LabCorp as commercial labs have brought up testing. And so depending on where you are, one or the other of those may be the better option for how to send out testing. But also the state departments of public health and the CDC are happy to talk to anybody who thinks they need to send testing on their patients, regardless of whether they're part of a big hospital or academic medical center or they're a community physician. So it varies by state, but here in Georgia, if you are a community doc who wants to test a patient, there's an online form you fill out where you describe what's going on, why you're worried, and then somebody from the state will get back to you about whether they want to test. And if they don't, then you can send out to a commercial lab if you're still suspicious.
Okay. As someone who currently is planning on flying multiple times a week domestically, do you recommend I change my current travel schedule?
So it really depends where you're going. I think there are a couple of hotspots that I would probably avoid. Anything where I was going to have a large gathering of people. So I would not want to hold a conference in Seattle right now because they are really working on containment efforts. But I honestly think that most domestic locations now are having community spread of this. And so I'm not sure that any place is any different than any other. In terms of safety specifically on the airplane, again, we recommend the exact same stuff. Bring a wipe down the tray table, bring some hand sanitizer, sanitize your hands, don't touch your face, don't rub your eyes, wash your hands before you eat anything on the plane, all of those common sense measures. But it really depends where you're going and what you're going to be doing while you're there in terms of safety.
Okay. Why is China recovering so fast?
So I think we don't have all of their data yet to know exactly. I think the epidemiologic curve right now in China is encouraging, that it looks like the number of new cases is really leveling off and dropping. But I think it will take another couple of weeks to make sure that that's accurate and that new clusters don't spring up. But I think honestly, they had such overwhelming spread at the beginning that, you know, as we were talking, one of the ways these things end is that everybody's had it and everybody's immune. And so I think in some of these areas, they have both reached a point where enough of the population's had it, that there aren't a lot of susceptible individuals left to get it. And then they did put very aggressive control measures in place. And you can debate a lot over whether those things are indicated or whether they help. and it'll be interesting to look at the data out of China, but they really did lock down movement and people having large gatherings and being out in public. And so it's possible that there's some benefit to that, although that comes with some risks of its own. So it's very hard to know.
Okay. After recovering from the virus, does the recovered patient have immunity to the virus?
And we don't know that for sure yet either, because what that will take is taking a lot of these people who have recovered and testing their antibodies over months to years to see how long they last. We would assume that it probably takes a little while to build immunity and that you probably do have immunity for a period of time. I think we just don't know how long that will last.
Okay. Do you suspect that Farr's law applies to COVID-19? Do you know what that is?
I don't either.
Okay, Michael, you're going to have to explain that a little bit for us, if you would. Okay, next question. What do you expect related to mutations or more dangerous?
So I think that there is some evidence starting to come out that there's probably more than one strain of this and that it did mutate probably pretty near the beginning to be more infectious for person-to-person transmission. Mutations are sort of by chance. You know, the virus could actually mutate in such a way that it's less infectious or more difficult to spread. It could mutate the other way. I think right now what they're picking up in terms of isolates worldwide, they all look pretty closely related to each other. So it doesn't look like we're having massive changes or shifts, but there's no guarantees that we won't, but there's also no guarantees that if it does mutate, it might not be in a way that helps us. So I think we'll just have to continue to look. We've got a lot of scientists worldwide who, as they track these outbreak clusters, are sequencing the virus. And so I think that there will be a lot of work around that area.
Okay. We have a lot of people that travel internationally, a lot of members, and we have a program that's going on in April, and one of our members is asking, what are the precautions for COVID-19 have escalated rapidly in the past 24 hours? What is your prediction for the situation on April 12th?
You're gonna hold me to this one? I think that over the next couple of weeks, we are going to continue to have an increase in cases, both in the United States and worldwide, because I think we're just starting to detect real community spread. For a long time, the cases that were reported in the United States all did have international travel links. And at this point, we're starting to see cases that don't. And so I think that because of that, and because of the fact that the symptoms of this are very hard to distinguish from a lot of other viral infections, we will continue to see spread. I think that there are a lot of places that are starting to cancel conferences and meetings just because you're going to bring a lot of people together in one area in an enclosed space where you could have spread. And I think that from a safety perspective, you just continue to evaluate. You're looking at how many cases are we having? What does the spread curve look like? What areas are reporting cases? And then what are the local public health authorities recommending? Are they saying, hey, based on what we're seeing, we really wouldn't have this meeting? Or are they saying, we really think this is okay as long as everybody who's symptomatic doesn't come? And so that will really vary by location. So I think this is just going to be a day-to-day thing for a while of watching what's coming out of our public health authorities and what are they telling us to do.
Okay. Can pets catch the virus?
So far, I don't think we know. I think it was the most read article on the Washington Post last week about the dog in Hong Kong who had maybe tested weekly positive. I think no one knows for sure. A lot of these viruses are zoonotic, again, meaning that both animals and people can have them, but whether household pets are susceptible to this particular strain, I don't think we know. There's not been any significant report that they are, but the Centers for Disease Control guidance just usually suggests that when you yourself are ill, you do, if at all possible, try to avoid really handling your pets just in case they can. But I don't think we've seen any evidence to know yet.
Okay. This is from Michael. He said he thinks you already addressed the epidemiological curve element, but Farr's law suggests that pandemics follow a steep bell curve with rapid infections and then rapid escalation.
And so far, this looks like that. It has, because I think they're estimating at the moment that R naught that sort of figure of how many people does every person who has coronavirus tend to infect, putting that somewhere between 2 and 3 with ongoing looks at that. So if every person who has this infects 2 to 3 other people, you do get that steep bell curve look to it. So far it looks like this follows that.
Okay. The store is out of hand sanitizer. Should I make my own?
So I think that'll continue to be a really interesting question of what to do with all of these shortages. And right now, if you can't get hand sanitizer, soap and water hand washing works just as well. And it's actually what you should do if you've got anything visibly soiled on your hands. So if you sneeze or cough into your hands, you may want to actually wash them. So nothing wrong with soap and water hand washing at the moment. If you've got a good recipe for hand sanitizer, go for it. I have not actually seen one, but I think that will calm down. I think we're seeing a lot of panic right now, mostly because this is just something new. And anytime something like this is new and it gets a lot of coverage, people are scared, and that's understandable. But I think over time, as this continues and we put some of these common sense measures into place, hopefully we will all be able to buy hand sanitizer and toilet paper again.
Okay, Marybeth, thank you so much. I know that you're on a tight schedule. Do you have a time for a couple more questions?
Sure.
Okay, great. Does donated blood get screened for the coronavirus?
At the moment, not that I know of, but people are what we call viremic, where you can detect virus in the blood for an incredibly short amount of time. So I don't think there's any evidence of that as a mode of transmission. This really does seem to be expelled in respiratory droplets as the big item of concern.
Okay. What should we do if an employee at one of our facilities is confirmed to have it? How long should employees be told to stay home, and what should be our cleaning measures?
So if somebody is confirmed to have it, anybody who had close contact with them, so was within 6 feet of them for more than a second as you pass by, is considered to have had a possible exposure. There's a wide range of risk associated with those, depending on how long was the exposure, how close were you, was the person coughing, how symptomatic were they. So all of those things determine risk. But if you do have people who have an exposure, they should stay home for 14 days after the exposure, because that is what's thought to be the upper limit of the incubation period. And the data on the fact that there's a risk stratification is mostly just meant for reassurance, because we do see people panic a little bit. And so letting them know that, yes, you may have had an exposure. This is probably not high risk. This is out of an abundance of caution. But stay home for 14 days, practice this social distancing where you try not to go out, you try to stay home. In terms of cleaning, really whatever you are normally using to clean your offices, whatever your crew uses, is probably effective against this. You can check. Cleaning products usually have a list of viruses and bacteria that they kill. And so you're looking either for something that says human coronavirus, which most of them do, or you're looking for something that says it has an EPA indication for novel pathogens. Either one of those two things should kill this. Quite honestly, this is not hard to kill with almost anything. So Lysol and Clorox wipes that you can buy at the drugstore kill this. All of the wipes we use in our hospital kill this. But you can check your cleaning products in that way if you're worried.
Okay. If you're advising employees where to go for the most accurate information and advice, what do you recommend?
So there are a couple of websites that are really good. Sometimes the local or state health department has an up-to-date website, and that's nice because it will include things that are going on right in your area. The Centers for Disease Control is working tirelessly to update their website. You'll see lots of these headings of interim guidance, and they'll give you the date that they were updated. So a lot of them were updated March 10th, the last time I looked. The World Health Organization has a good site. Johns Hopkins has a good surveillance site. You can get up to the hour updates of the map of cases if you want to give yourself palpitations. And NETEC, that was the National Ebola Training and Education Center, that's now expanded to be sort of the National Emerging Pathogens Training and Education Center, that was an NYU, Nebraska, Emory partnership, and now has a lot of other participants. They've also got a website where they've got links to all of these other sites and some of their own information. And those are all good sites.
Okay, great. Does mask wearing by healthy people help?
Not that we know. There has never been a good study of this in the community, but there's a lot of reasons to think it probably doesn't. One of them is that the pictures you always see are of people wearing masks walking around outside, and that's the one place you definitely don't need one. You're in a big open air area with good airflow. The types of masks that people wear are also not a perfect seal, and sometimes just having the mask on actually makes you more likely to expose yourself, because I don't know about all of you, but if I have something here on my face, I keep wanting to touch it. And so you end up adjusting the mask, and then you're touching your nose, you're touching your eyes, you're touching it. They also aren't meant to be worn for hours on end. They get wet because you're breathing and talking and coughing out into it, and they don't work when they're damp. They don't filter particles well. And the final reason is that because a lot of our masks are made in China, and because China has had this huge run of cases, and they also did have people stay home from work and not go to some of the factories that produce these things, numbers of mask supply are a little low worldwide. And so the people you want to have them are the places we know they help. And we know they help if somebody who is symptomatic wears one when they have to go out to get medical care, because it keeps them from coughing or sneezing some of those infectious particles out at you. And we know they work in our healthcare settings when we're taking care of people who are sick, and we pair them with a lot of training and a lot of other infection control measures and a lot of engineering controls and how our hospitals are designed. And so we've got to have them available for our healthcare workers, because if our healthcare workers get sick, then we're in real trouble. So I think the best thing to do is, if you're healthy, avoid people who are sick, wash your hands, don't touch your face. If you're sick, don't go out. Do wear a mask if you have to seek medical care, because you'll protect your doctor and you'll protect the other patients in the waiting room. But if you're healthy, save them for people who really need them, because that ultimately protects you too. Because it means there's people who can take care of you at the hospital if you are sick.
Okay. Member asked, what extent of this pandemic is a bit of an overreaction because of social media?
So I think I told somebody the other day that there were two categories of misinformation about this that were problematic. The category of this isn't a problem at all, we're all going to be fine, and the category of the world is ending. Because the real truth is somewhere in the middle. This is a problem, and this is more of a problem than a seasonal flu year, because we don't have a vaccine and we don't have anybody who's immune. However, this is also something that causes mild illness in most people who get it, and that probably when all is said and done and we tally cases, we'll have a mortality rate under 1%. So the truth is somewhere in the middle there, and there's a lot of hype on both sides of this. I think we want people to not panic. We do want people to be prepared. So we want people to not buy all of the hand sanitizer and all the toilet paper and all the face masks, but we also want people who are sick to stay home and to take it seriously. So I think we need to chart a course somewhere in the middle. And there definitely is some hype about it that's not helpful, and some information about, things that might treat this or cover this that isn't accurate. And so that's where just sticking to those websites that are frequently updated with the latest information that we know from CDC and WHO and your local health department, those are all good things to do to avoid that.
Well, on that note, I think we're going to let Marybeth continue with her schedule for the day. If anyone, I'm sorry I couldn't get to all the questions, but Marybeth and Heather have agreed to answer any questions, and I'll get them back to you that we were not able to get to today. Marybeth, this has just been so informative. We can't thank you enough for being part of our very first global webinar. So on that, Heather, do you have anything to add before we drop off?
No, just thank you for the opportunity to help inform people about this serious disease, but help relieve some of the panic that I know is out there.
Okay, great. Again, Marybeth, thank you. And if anyone has questions other than what I can see here, just send them to me and we'll get answers for you. Thanks so much for joining us.
Thanks a lot.